What does the return to school during the COVID-19 pandemic look like? I'm Shanda Gallego here at the Prospect Primary School with an inside look into their state of readiness in the age of the coronavirus.
I'm going to be a little distant from you so that we can take our masks off.
That's perfectly fine.
As normally, if we're moving around the corridors, we would be insisting that you wear your masks, hence our no mask, no entry sign. But for this, and in order to be able to hear me, I'm going to take it off. And we'll keep a little bit of distance.
Totally understand. Okay. Principal Reed, how important was it for you in the school to create a unique guidance document? I know the Minister of Education, Honorable Juliana O'Connor-Connolly, along with the Department of Education Services, they recently toured the various schools across the Cayman Islands, specifically here at Prospect, and they were able to see how exactly we're going to be positioned and situated for our kids. So how important was that to create the guidance document unique to your school and to your students?
There are certain key concepts that have got to be common to all. And for that guidance, we've got guidance from the Chief Medical Officer, we've got guidance from the government on opening schools. But you're right, we have to make it unique to the schools because each school is different. I mean, our smaller schools in the East End can do things differently to us. We are a completely enclosed building with 28 pupils in most of our classes, so we can't operate in exactly the same way as the school next door that don't have such large class sizes. So we know our building, we know how we can make it work within a set of rules, and that's what we've had to do.
Okay, and I know the minister actually came right in when you were doing the preparations. So I know that there's still a little bit more finishing touches that we have. So let's talk about the measures and some of the, additional measures that have been put in place to ensure that when these kids come back to school, they're back in a supportive, nurturing, and safe environment.
Yeah, absolutely. One of the biggest changes is going to be, as a visitor coming to the school, once the children are back, this is as far as you're going. Because once we go past this point, it's going to be staff and students only, because we want to limit the number of people that are coming into the building.
Thank you for joining us. Let's talk about these additional measures, and I know that's unique to each school, right?
Yeah, what we've done, we've taken an integrated approach across all schools throughout all 3 islands. We have standardized signage on the ground indicating the 6-foot distances throughout the corridor. And also for the plexiglass, we're installing plexiglass barriers at all reception stations throughout the whole of the schools. There's a little backlog of plexiglass, but in the event we'll have some plastic or something else that would substitute that until we get the plexiglass on island.
All right, now walk us through and how our kids would be able to navigate throughout the school with these additional measures.
Now, we've spent the entire summer getting every inch of the building cleaned and sanitised, so the building's absolutely sparkly, and what we can't do is have an influx of a huge number of people coming in and potentially bringing the virus in with them. The rules as they come into school, everyone moving through the corridors, as you see, is masked up, and as they move through the school, the expectation is that masks are on and we keep 3 to 6 feet apart as we're moving through the school, and we make sure that we're not colliding classes and that sort of thing. As we go into classes and the children are sat down, and there are desks, and I'll show you a classroom in a moment, the classes are set up to be socially distant. When the children are sat down and they're working quietly, at that point they can take their masks off as well, so that they can take part in the lesson and they haven't got their masks on for the entire day, because that would be a bit much for them.
So we're still having ongoing works go on as we walk. So you'll see desks being moved, you'll see desks being cleaned and that type of stuff.
Okay.
What we will ensure is in place is that the students know that we only have 3 people at a time in the bathroom. We'll be drumming home to the children that when you've been in the bathroom, normally you'd be washing your hands, but at this point you're doubly washing your hands to make sure. The children will have spacing out in the corridor here to remind them that if there are other people in the bathroom, they wait and they go in, so there's only a couple in there at any point.
So as we enter this sign as standardized, 3 foot.
Keep your distance.
Keep your distance. And then in every classroom, there's 3 foot from end to end. So basically, it's about 5 foot total of social distance.
Okay.
All desks are being wiped down twice a day. When the kids go out, when they come back to have their lunch, we'll have them wiped down again.
And what I'm really pleased about today is that we're allowed to once the children are sat down, they can take their masks off during lesson time so they can get on with their work, and that's really great, because I know that's been a bit of a worry for parents. and it's really going to help the children as well, because our youngest one's sitting there for 6 hours a day with a mask on is going to be an awful lot to ask. So it's going to really help. I mean, we do want to try and keep it as normal as we can for the children, but obviously moderated by keeping it safe at the same time. So we're going to divide up the playground so that each year group has its own, or each class has its own area. So they can come out, they can have a bit of a run round.
And Mr. Gardner, you were mentioning about the outdoor provisions.
Mainly we have some waiting areas at front. When the kids are dropped off in the morning, they'll be separated between the 3 areas. And also at each exit point and entry point into the building, we've removed the water fountains and installed hand sinks. We're having dispensers to dry your hands and also soap to wash your hands installed. That's going to be installed shortly. But at the water fountains on the outside of the building, we're going to replace with this type of system.
Mr. Ray, thank you so much for joining us.
Thank you for having me.
Now let's talk about the canteen services and how food will be consumed and how food will be served.
Sure, definitely. The good thing about the canteen service is that it was one service that really had the protocols established long before we had any issues with regard to COVID, because typically canteen servers would be in a position where they would have been covered with masks, they would have used gloves, they would have sanitized the dinnerware that was being used. So all of that will continue. The key part that will be quite different is that meals themselves won't be served within the cafeteria area. They'll be served within the classroom, right? And some schools may have all meals picked up for class and taken to the classroom. It may be a case where students are coming and collecting meals and going back to the classroom, but that's up to the organization of the school and how best they do it. But the important thing is that it'll be covered meals, and the eating of the meals wouldn't be in the cafeteria space itself.
Thank you, Principal Reed, for just giving us a little bit more insight, and Mr. Ray to you as well. But I'm going to stay with you a little longer because I know that there are some measures and protocols for new school bus transportation.
Absolutely.
So we're going to head out and check the school buses for some of those measures.
Absolutely.
Let's go. Mr. Ray, I feel like I'm going back to school. It just feels like that because we're here at Barnes Bus Transport Depot, where we're going to be talking about the school bus transportation protocols. I know this is really important. So what can you tell us with this? Sure.
So ordinarily, in a normal environment, we would have had our school children just sitting on the bus and being transported as normal. With the advent of COVID, of course, we had to put other protocols in place. And the main thing that we are going to do, we're going to make sure that we sanitize hands when they get onto the bus. And the bus companies, they have their strategies of how they're going to start with social distancing. But the reality is that we can't maintain physical distancing within the bus. We would have way too many trips. It would take too long for kids to get to school. So we are allowed to have 2 per seat. But here at Barnes Bus Transport, Mr. Barnes has his strategy, as all the other bus companies do, in terms of how they're going to allocate students to seats. So I think it might be useful to speak to him.
Okay. Oh, wow. So we have their markings.
No, we have this marking for a reason. You know that it's 2 to a seat, but we start with, not with the X's. When you see the blank, you can sit there. Mr. Mark will sit on the other side. Okay. And then who else? Animal come. Then the next student will sit here. And then the next one will sit here until the bus is full up down. So the bus will be spread out. That will be before each pickup. And after we drop the children off and let them off at school, then the bus warden or the driver will sanitize with a little hand beer.
Yes, because they touch a lot of different places.
Anyway, that we will do that each time before the bus go back out. Now, when the bus go ready to go back out for the second pickup, we'll do the same thing again. And each entrance for the bus, children will sanitize the hand. And the bus warden sits here, the driver sits there, nobody sits across from the driver. So the driver will have no connection with the children, only the warden, unless the driver have to get involved in something.
Basically, Shanda, I think the important points You know, we making sure that not only the students, but the bus driver and the bus warden are kept safe. So the disinfecting, the sanitization of hands, the X's on the seats to kind of demarcate where students should sit initially until the bus fills up. All of these are protocols that we're putting in place just to make sure that we keep everyone safe, spaced as much as possible for the initial part of the trip. But as more students get on, we've got clearance from public health to allow 2 per seat, provided that masks are worn constantly throughout the trip. Mr. Barnes is just one example of a number of dedicated companies that we have providing this service to our school children. When we think of the responsibilities of teachers, the responsibilities of special support aides, teacher assistants, any staff in schools, the reality is that the very first interaction that students have with anything school related, for most of them, is the school bus, because the school bus picks them up first in the morning. Yeah. So this sets the tone for the rest of the day. Parents
are very concerned with this step. Like you said, it sets the tone for the day and for these kids. So seeing it and having that visual, it helps parents and puts them at ease, knowing that, hey, my kids, I'm sending them off for the day, and they can be confident that they're in good hands.
Absolutely.
There you have it, an inside look into the state of readiness into our government schools in the age of coronavirus. I'm Shanta Gallego.
The COVID-19 pandemic is affecting everything from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Cayman-kind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. You are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride. Me. You.
Helping children cope during the pandemic is important. Remember to lead by example and take care of your own needs too. To support your child, listen and acknowledge their fears and questions. Provide clear information and be aware of your own reactions. Help children by creating new routines, limiting their exposure to media, and encouraging them to talk about what they've seen and heard. For free and confidential support, call the Mental Health Helpline at 1-800-534-6463.
The coronavirus has caused our most vulnerable to feel isolated and lonely. Due to their age and the probability of having underlying illnesses, our seniors rely on family and friends for comfort. You can help protect our elderly by sharing your love from a distance by following these helpful tips.
Remaining at home can lessen the possibility of contracting the virus and passing it on. Reach out to nursing homes or those in assisted care by sending homemade cards, artwork, or handwritten letters. Call your elderly family members often and stay on longer. Read a book or watch a show together while on the line. Gift books, games, craft supplies, a deck of cards, or maybe a puzzle to your elderly family members.
There are many resources that can help us care for our elderly. For a list of these, please visit www.gov.ky/coronavirus or call the Older Persons Helpline at 1-800-534-2222.
What does the return to school during the COVID-19 pandemic look like? I'm Shanda Gallego here at the Prospect Primary School with an inside look into their state of readiness in the age of the coronavirus.
I'm going to be a little distant from you so that we can take our masks off.
That's perfectly fine.
As normally, if we're moving around the corridors, we would be insisting that you wear your masks, hence our no mask, no entry sign. But for this, and in order to be able to hear me, I'm going to take it off and we'll keep a little bit of distance.
Totally understand. Principal Reed, how important was it for you in the school to create a unique guidance document? I know the Minister of Education, Honourable Juliana O'Connor-Connolly, along with the Department of Education Services, they recently toured the various schools across the Cayman Islands, specifically here at Prospect, and they were able to see how exactly we're going to be positioned and situated for our kids. So how important was that to create the guidance document unique to your school and to your students?
There are certain key concepts that have got to be common to all. And for that guidance, we've got guidance from the Chief Medical Officer, we've got guidance from the government on opening schools. But you're right, we have to make it unique to the schools because each school is different. I mean, our smaller schools in the East End can do things differently to us. We are a completely enclosed building with 28 pupils in most of our classes, so we can't operate in exactly the same way as the school next door that don't have such large class sizes. So we know our building, we know how we can make it work within a set of rules, and that's what we've had to do.
Okay, and I know the minister actually came right in when you're doing the preparations. So I know that there's still a little bit more finishing touches that we have. So let's talk about the measures and some of the, additional measures that have been put in place to ensure that when these kids come back to school, they're back in a supportive, nurturing, and safe environment.
Yeah, absolutely. One of the biggest changes is going to be, as a visitor coming to the school, once the children are back, this is as far as you're going. Because once we go past this point, it's going to be staff and students only, because we want to limit the number of people that are coming into the building.
Thank you for joining us. Let's talk about these additional measures, and I know that's unique to each school, right?
Yeah, what we've done, we've taken an integrated approach across all schools throughout all 3 islands. We have standardized signage on the ground indicating the 6-foot distancing throughout the corridor. And also for the plexiglass, we're installing plexiglass barriers at all reception stations throughout the whole of the schools. There's a little backlog of plexiglass, but in the event we'll have some plastic or something else that would substitute that until we get the plexiglass on island.
All right, now walk us through and how our kids would be able to navigate throughout the school with these additional measures.
Now, we've spent the entire summer getting every inch of the building cleaned and sanitised, so the building's absolutely sparkly, and what we can't do is have an influx of a huge number of people coming in and potentially bringing the virus in with them. The rules as they come into school, everyone moving through the corridors, as you see, is masked up, and as they move through the school, the expectation is that masks are on and we keep 3 to 6 feet apart as we're moving through the school, and we make sure that we're not colliding classes and that sort of thing. As we go into classes and the children are sat down, and there are desks, and I'll show you a classroom in a moment, the classes are set up to be socially distant. When the children are sat down and they're working quietly, at that point they can take their masks off as well, so that they can take part in the lesson and they haven't got their masks on for the entire day, because that would be a bit much for them.
So we're still having ongoing works go on as we walk. So you'll see desks being moved, you'll see desks being cleaned and that type of stuff.
Okay.
What we will ensure is in place is that the students know that we only have 3 people at a time in the bathroom. We'll be drumming home to the children that when you've been in the bathroom, normally you'd be washing your hands, but at this point you're doubly washing your hands to make sure. The children will have spacing out in the corridor here to remind them that if there are other people in the bathroom, they wait and they go in, so there's only a couple in there at any point.
So as we enter this sign as standardized, 3 foot.
Keep your distance.
Keep your distance. And then in every classroom, there's 3 foot from end to end. So basically, it's about 5 foot total of social distance.
Okay.
All desks are being wiped down twice a day. When the kids go out and they come back to have their lunch, we'll have them wiped down again.
And what I'm really pleased about today is that we're allowed to once the children are sat down, they can take their masks off during lesson time so they can get on with their work, and that's really great, because I know that's been a bit of a worry for parents. and it's really going to help the children as well, because our youngest one's sitting there for 6 hours a day with a mask on is going to be an awful lot to ask. So it's going to really help. I mean, we do want to try and keep it as normal as we can for the children, but obviously moderated by keeping it safe at the same time. So we're going to divide up the playground so that each year group has its own, or each class has its own area. So they can come out, they can have a bit of a run round.
And Mr. Gardner, you were mentioning about the outdoor provisions.
Mainly we have some waiting areas at front. When the kids are dropped off in the morning, they'll be separated between the 3 areas. And also at each exit point and entry point into the building, we've removed the water fountains and installed hand sinks. We're having dispensers to dry your hands and also soap to wash your hands installed. That's going to be installed shortly. But at the water fountains on the outside of the building, we're going to replace with this type of system.
Mr. Ray, thank you so much for joining us.
Thank you for having me.
Now let's talk about the canteen services and how food will be consumed and how food will be served.
Sure, definitely. The good thing about the canteen service is that it was one service that really had the protocols established long before we had any issues with regard to COVID, because typically canteen servers would be in a position where they would have been covered with masks, they would have used gloves, they would have sanitized the dinnerware that was being used. So all of that will continue. The key part that will be quite different is that meals themselves won't be served within the cafeteria area. They'll be served within the classroom, right? And some schools may have all meals picked up for class and taken to the classroom. It may be a case where students are coming and collecting meals and going back to the classroom, but that's up to the organization of the school and how best they do it. But the important thing is that it'll be covered meals, and the eating of the meals wouldn't be in the cafeteria space itself.
Thank you, Principal Reed, for just giving us a little bit more insight, and Mr. Ray to you as well. But I'm going to stay with you a little longer because I know that there is some measures and protocols for new school bus transportation.
Absolutely.
So we're going to head out and check the school buses for some of those measures.
Absolutely.
Let's go. Mr. Ray, I feel like I'm going back to school. It just feels like that because we're here at Barnes Bus Transport Depot, where we're going to be talking about the school bus transportation protocols. I know this is really important. So what can you tell us with this?
Sure. So ordinarily, in a normal environment, we would have had our school children just sitting on the bus and being transported as normal. With the advent of COVID, of course, we had to put other protocols in place. And the main thing that we are going to do, we're going to make sure that we sanitize hands when they get onto the bus. And the bus companies, they have their strategies of how they're going to start with social distancing. But the reality is that we can't maintain physical distancing within the bus. We would have way too many trips. It would take too long for kids to get to school. So we are allowed to have 2 per seat. But here at Barnes Bus Transport, Mr. Barnes has his strategy, as all the other bus companies do, in terms of how they're going to allocate students to seats. So I think it might be useful to speak to him.
Okay. Oh, wow. So we have their markings.
No, we have this marking for a reason. You know that it's 2 to a seat, but we start with, not where the X is. Where you see the blank, you can sit there. Mr. Mark will sit on the other side.
Okay.
And then who else? Animal come. Then the next student will sit here. And then the next one will sit here until the bus is full up down. So the bus will be sprayed out. That will be before each pickup. And after we drop the children off and let them off at school, then the bus warden or the driver will sanitize with a little hand be.
Yes, because they touch a lot of different places.
Anyway, that we will do that each time before the bus go back out. Now, when the bus go ready to go back out for the second pickup, we'll do the same thing again. And each entrance for the bus, children will sanitize their hand. And the bus warden sits here, the driver sits there, nobody sits across from the driver. So the driver will have no connection with the children, only the warden, unless the driver have to get involved in something.
Basically, Shanda, I think the important points we making sure that not only the students, but the bus driver and the bus warden are kept safe. So the disinfecting, the sanitization of hands, the X's on the seats to kind of demarcate where students should sit initially until the bus fills up. All of these are protocols that we're putting in place just to make sure that we keep everyone safe, spaced as much as possible for the initial part of the trip. But as more students get on, we've got clearance from public health to allow 2 per seat, provided that masks are worn constantly throughout the trip. Mr. Barnes is just one example of a number of dedicated companies that we have providing this service to our school children. When we think of the responsibilities of teachers, the responsibilities of special support aides, teacher assistants,
Hello, everyone, and welcome to today's press briefing. I'm Donna Bush. I'm always glad to have you join us here on our channels as well as on Radio Cayman. We begin with a prayer from Pastor Martin Royer.
Good day, everyone. Would you please pray with me? Heavenly Father, we come to you at this time, thanking you for another day, thanking you for the gift of life, thanking you for the many blessings you have poured out upon our lives, both material and spiritual, in the past, and asking the Heavenly Father that you would continue to pour out your blessings upon us now in the present and even in the future. Father, we are truly grateful for our leaders, for the wisdom, the insight, the vision, the courage that you have given to them to help us to navigate these very troubling and difficult times that we have been through. Times that have negatively and adversely affected our lives and our economic well-being. We thank you, Lord, for the medical workers. We thank you for all the frontline workers and for all of the professionals who have been involved in providing us with the care that we have needed through these very trying times. Lord, we ask your blessings upon all our citizens. We pray for those who have been negatively impacted, the Heavenly Father, that you would provide them with the sustenance and the recovery that they need in their lives. We pray for today's proceeding. We pray that you would send your Spirit, that he would lead and guide us in our discussions and deliberations, and all that we do, Father, would be to the honor and glory of your name. We pray this prayer and we ask it in Jesus' name. Amen.
And thank you, Pastor Royer. We now welcome our panelists, His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health, and the Honourable Minister for Commerce, Planning and Infrastructure. With us in the studio are the Chief Medical Officer, the Medical Officer of Health, the Director of HMCI, the Sign Language Interpreter, and members of the media are also back with us in studio today. Welcome to them. We begin with the latest from Dr. Lee.
Good afternoon. There are 84 PCR tests which are negative since Tuesday and 2 which are positive. These were picked up as screening tests. The people are asymptomatic and they were in travellers. This brings the total number of positive cases in Cayman to 207, with 204 recovered and 4 from Cayman Brac. There are 282 people in government isolation, 42 in home isolation. There were 6 flu hotline calls, of which 2 were related to influenza-type symptoms. As for the antibody tests that we've been reporting, there are 2,516 which have been done, representing around 3.9% of the population, with 61 positives. 37 people of those positives were previously positive on a PCR test. 6 were contacts of previous PCR positive people, which leaves 18, 8 of which you had a travel history, and 10 of which you have no identifiable COVID-19 contact history. I need to let you know that 10 days ago, one of our screening tests picked up a positive individual in the community. However, according to our Public Health England guidelines, we performed confirmatory tests, both of which came back as negative on the same sample and on the same day. However, in the interest of absolute caution, that individual was isolated along with their contacts and has subsequently had a negative test several days later. The world approaches 900,000 deaths from COVID-19, which is a staggering number. We will no doubt be at 1 million within the month. In the USA, cases remain high, although there is a falling trend. There are worrying increases in Jamaica, in the Turks and Caicos. If you have a look at ranking of countries by their prevalence, which is the number of cases they have per 100,000 population, Aruba sits at number 2 in the world as having the most numbers relative to the population. Saint Martin at 3, Turks and Caicos at number 12, Bahamas at number 14, Honduras at number 24, Trinidad and Tobago at number 25, USA at number 26, Jamaica at 59, British Virgin Islands at 78, the United Kingdom at 108. And just to pause a bit at the United Kingdom, we've all seen that there's been a surge in cases across Europe, in Spain, France, Italy, and Germany, where the WHO has warned of a resurgence that they think may well take place during the months of October and November. Indeed, the United Kingdom has exceeded its own prevalence levels itself, at which point it has been imposing requirements for isolation from people returning to the United Kingdom. Going on with the list that I gave of the ranking of prevalence, we then have Barbados at number 126, Bermuda at number 148, and I just want to pause with those two. And those are quite good figures because that's getting very near the end of the list. Those two countries have opened their borders, but coupled with both strong management of the arriving passengers and PCR testing, they've managed to keep their numbers well under control. Cayman is doing clearly even better with at a ranking of 166. I was shown a graph this morning from CARICOM of the borders reopening in the Caribbean in June, and it's clear that there is a very strong and sharp uptick in the number of cases across the region. Further afield, cases rise in India. It's overtaken Brazil to have the second highest number of cases globally, and we all know that there have been second waves in countries which have previously done well: New Zealand, Australia, South Korea. These figures are the backdrop to the decision-making behind the government. The safest countries appear to be those where borders have reopened, where they have strong COVID management processes backed up by PCR testing. I recognize that I have no doubt the media wish to ask me a lot of questions, but questions about reopening itself will need to wait until after my excellent and honorable colleagues have given their presentations. Thank you, Donna.
Okay, we're going to now move to questions for Dr. Lee from members of the media. Who's going to go first?
Thank you, Donna. Good afternoon, Dr. Lee. Can you give us an outline of why the situation surrounding those 42 people in home isolation? Is it all because of medical reasons? We've had some concerns about that raised, about what the criteria is and why it is that some people, and that's quite a big number now. It was only a handful before.
It's absolutely all about medical reasons. There's not been one exemption that has not been for a medical reason. We have been relatively stringent in our requirements for a medical reason, in that we are requesting that we have a specialist opinion to make any justification. Clearly, if there is a member of the family that needs to be, that would fit that requirement, if the family is quite large, it could be that quite a number of people are actually in the household isolating. So there are cases where there are families of perhaps 5 who, because of one person has the need, the others have all equally been isolated.
Okay, thank you very much for that. The other question is the numbers. Obviously, we've seen a bit of a drop, and if you could just give us some...
In the testing?
Yeah, in the testing numbers. If you could explain to us why that's so. I think we probably know, but if you could outline that and also explain why we maybe need those numbers to go up a bit more.
I think at the moment we're probably doing all right, to be honest. We are continuing to test the essential workers, the healthcare workers, nursing homes, prisons, other frontline staff, and those numbers continue to come through. If as we begin to see more travel across the borders, we may well increase the numbers of testing that we do. But at the moment, we are relatively locked down, and the numbers of travelers are not great. So we haven't changed our requirements in that regard. It's also quite difficult to get people to come, because they recognize the fact that we're in a really good position at the minute. I've said before that the threat is still there. It's small, but it's still present. I'm still reporting the odd positive to you periodically, whether it be here or through the reports that you get that are written.
Also, finally, because again, we've got 2 positives from travellers, what concerns do you have in public health about the potential transmission from people in quarantine to those that are working with them, that are feeding them, that are taking care of them, and again, with these people that are in home isolation?
We've been doing that for quite some time, so we know what we need to do in order to keep the staff around safe. But there is always that potential. I cannot deny that, which is why my guard is always a little bit up, and was why I am using my own advice and trying to keep my distance from people. And I personally, as people will have seen, am still wearing a mask occasionally when I'm in public, when I feel it's a public place. And I would encourage people to consider that as a protection for themselves. Going forward, that information, that advice may well change and become more stringent, may be covered by regulations, but I would advise people to continue to exercise caution.
Thank you. Thank you very much.
Hey, good afternoon, Dr. Lee.
Good afternoon.
I just want to clarify, the 2 positive cases, those people were in isolation at the time when they found out? Okay, can you just run us through again the process right now for people who are traveling? Everything is as it has remained?
As in after today?
Just generally speaking, I guess at the time that these 2 people tested positive.
Yeah, so at the moment, people will arrive from whatever transport they come on. It's almost invariably, it's a plane. They are transported under designated transport to wherever their isolation place is. Normally, it's to the government isolation facility. At which point they stay in their accommodation, and at the end of 14 days, which is often actually at practical level happens to be on the 15th day, although if they arrived in the morning, they may well still get their test on the 14th day. But at the end of a 14-day period, they are then eligible to have a repeat test, and if that test is negative, they are released into the community. If it's positive, they then need to stay until they've exceeded a 10-day period where they would be retested again, provided during that 10 days they've not developed any symptoms, because if they develop symptoms, they would sort of move into a different category.
Right. And these 2 were asymptomatic?
They were.
Okay. A couple questions about the bio button. From my colleague James Whitaker. If we are already testing and geofencing visitors in the first phase of the tourism renewal, what additional purpose does the bio button serve?
If I may, I might leave that answers about that till after the presentation from Premier and the other members.
Sure, no problem. Okay. You know what? In that case, all the questions about the bio button, I'll hold off until then. So thank you.
Okay, thank you, Kevin. Thank you very much, Dr. Lee.
Thank you.
Okay, thank you to Dr. Lee and to members of the media there. We now go to the Honorable Premier for his remarks.
Thank you, Donna. Hello, everyone. I have quite a bit to talk about this afternoon. I'm going to start with what I regard as the easy, simple stuff. The tourism stipend. When tourism came to an abrupt halt, workers in the industry were among the first economic casualties. Thousands of Caymanians were either furloughed or lost their jobs completely. As a result, government stepped in, as any caring government would do, to provide economic stimulus programs for businesses and financial support for displaced workers in the tourism sector. The Ministry of Tourism initially funded payments of $600 shortly after the onset of the pandemic to tourism sector workers. This was followed by a stipend of $1,000 per month for 3 months, July, August, and September, paid to more than 2,000 tourism workers who registered for the program. I am pleased to announce today that the stipend program is being extended for a further 3 months from October to December. Persons who already received these monthly payments will continue to do so until December. There is no need to reapply. From 14th of September, the registration period will be reopened to give persons who worked in the tourism industry and who have not previously applied for the stipend an opportunity to do so. To qualify for the tourism stipend, persons must provide proof of being Caymanian either through voters registration, Caymanian status certificate, or right to be Caymanian certificate, and provide proof of being employed within the tourism industry. To apply for the stipend, you should access stipend.urcayman.ky. That is the website. Further details regarding the application process will be publicized in the coming days. And I repeat that persons who have previously applied or who are already receiving the stipend should not submit an application, as this will significantly delay the verification process for all applicants, because it just gives us one more unnecessary set of documents to consider. I want to say a few words about the open house, which is currently underway. The Ministry of Tourism has partnered with WORC, WRC, and a wide range of tourism industry partners to offer a 2-day tourism open house to give Caymanians an opportunity to reskill or prepare for a job in the future as a qualified and desirable tourism employee. The open house allowed displaced tourism workers to find out about job vacancies in the industry, primarily as a result of expatriate workers having left, and provides them with opportunities to register for courses or receive training to fill roles in the future, if they are not currently qualified to do so. Just over 200 persons registered yesterday, and the event continued today for persons with surnames beginning with Q to Z, or Z, as the Americans say. Persons who could not attend yesterday were also welcome to attend today's session. The open house is providing one-on-one sessions with a range of tourism stakeholders to learn about the different areas of work within the accommodations, dive, and restaurant sectors of the tourism industry. The opportunity to sign up for tourism courses with the University College of the Cayman Islands and the School of Hospitality Studies. The opportunity to sign up for tourism Pride webinars. And it also allows unemployed persons to register with work, and obviously networking opportunities with tourism sector employers. I would like to thank a number of tourism partners, entities who are partnered with the government with respect to this particular initiative: Marriott Grand Cayman, Wyndham Reef Resort, the Westin Grand Cayman, the Kimpton Seafire Resort, the Ritz-Carlton Grand Cayman. That's the accommodation sector. In the restaurant sector, we have Eats, Legends, Yoshi, and Market Street Limited. In the dive sector, GoPro Divers, Red Sail, Clearly Cayman, Sunset House, Ocean Frontiers. And on the government side, the Department of Tourism, UCCI, and WORC. Now, turning to the much anticipated announcement regarding what we're calling the revised phased border opening plans for September and October. The Cayman Islands is currently rated as COVID-free, a status that has been hard-won through adapting our ways of living and making tremendous sacrifices for the greater good. Protecting lives and enhancing public safety has been a government priority since the onset of the pandemic, and this has continued to be a key focus in all of the deliberations and plans being formalized to facilitate the reopening of our borders. I would like to emphasize, before I go into any more detail, that the phased opening, which commences on the 1st October, only pertains to air arrivals on Cayman Airways repatriation flights or the BA Airbridge flights between London and Grand Cayman. Our ports will remain closed to cruise ships for the remainder of the year. During the month of September, this month, there will be no change in the current arrangements for approved travel to the Cayman Islands, except to trial some aspects of the new arrangements we have planned for the 1st of October opening of the borders in advance, using a small number of pre-selected participants. The arrival process that is currently in place stipulates that all persons who wish to travel to the Cayman Islands must register their travel requests with travel time and complete the online application form in order to apply for pre-travel approval. Travelers who do not complete this process are not permitted to board a repatriation flight to Grand Cayman. On arrival in Cayman, travelers are subject to 14 days quarantine in a government-managed isolation center, and a PCR test is conducted on day 15. Test results take 24 to 72 hours, and a negative test result is required to be allowed to leave. As has already been announced, from 1st October 2020, the Cayman Islands borders will begin reopening in phases. Given the ever-increasing number of positive cases of COVID-19 in many of the countries around us, particularly the United States of America and Jamaica, we have had to adjust our initial plans, especially regarding isolation. A new arrivals procedure which incorporates the use of an electronic monitoring device will be introduced, and travelers who select that option and meet the criteria will be permitted to complete their mandatory quarantine in residential accommodations as an alternative to the government-managed facilities. The electronic monitoring device selected is being used successfully in Hong Kong to help ensure that persons in isolation remain where they're supposed to be. We will also continue and indeed ramp up the program of random physical checks on those quarantining at home, as was being done successfully as part of the local testing, tracing, and isolating process. In other words, we're using a belt and braces approach with technology backed up by physical verification. I want to say a few more words about the September 17th trial period. In preparation for the phased border reopening, travelers from 20 to 25 households arriving on the BA flight on the 17th of September will be identified to take part in a trial program, the purpose of which is to gather information on various aspects of the new process, how well they work or not. This includes the time required to process arrivals under the new procedure that will be in effect from the 1st of October, assessing the airport's capability to conduct COVID-19 tests, should that be included as part of the arrivals process at a later date, and evaluating the electronic device technology, including its ability to meet our needs and the user experience. The person selected to participate in the 17th September testing program will be required to wear the monitoring device, quarantine in a residential or other accommodation approved by the medical officer of health, and remain in self-isolation for a minimum of 14 days. Undergo COVID-19 testing on arrival and be retested on day 15, after which a negative test result and sign-off by the medical officer of health will be required in order to receive clearance for self-isolation to be discontinued. Because we will not be allowing a shorter quarantine period at this time, the use of a bio button, as previously mentioned, will not be needed. On the 1st of October, we will launch the first phase of the border opening plans, as I've just said, with a pilot program with new arrangements and safeguards. These changes will enable the Cayman Islands to welcome additional categories and greater volumes of airline travelers, and to do so safely. In addition to the lessons learned from the September testing, the pilot in October will allow the government to trial the new arrangements and safeguards, and to use the information from the September pilot to decide if any improvements are needed going forward. This approach will further enable the government to consider any changes that are required as a result of local or international developments relating to the COVID-19 pandemic. At the same time, the number of travelers coming into the Cayman Islands will be controlled. The government has set a target of 800 travelers for the month of October. This is a soft opening or reopening. We are not reopening our borders to commercial flights. As before, we will focus on repatriation flights and private charters, and the continuation of the fortnightly BA flights from London, which will have started this month. From 1st of October, the requirement for all inbound travelers to receive pre-travel authorization from Travel Time will remain in place. However, a number of other changes will take effect as part of the phased border opening. These are as follows. The categories of persons eligible to visit will be extended beyond Caymanians, permanent residents, and work permit holders and their families, to also include persons who own property in the Cayman Islands, as well as persons looking to live and work from here for an extended period of time, and other approved visitors. The locations where persons may quarantine after the 1st October will be expanded to include residential accommodations approved by the Medical Officer of Health, in addition to government-operated isolation facilities. However, self-isolation at a residence must be combined with the use of monitoring device technology. Persons who choose not to participate in the monitoring program will be required to quarantine in a government facility for a minimum period of 14 days and will be tested on day 15. A negative test result will be required to leave the facility. All persons entering the Cayman Islands will be tested on arrival at the airport and will be taken by approved transport from the airport to begin their quarantine period, either at a residential accommodation or in a government facility. The test result is anticipated to take 24 to 72 hours. In both instances, the quarantine period will be 14 days with a PCR test on day 15. All persons who are not ordinarily resident in the Cayman Islands will be required to have health insurance that includes COVID-19 coverage. During the month of October, Cayman During the month of October, Cayman Airways and British Airways will continue to be the only two airline carriers operating repatriation flights to and from the Cayman Islands. Seat capacity remains limited, and therefore non-essential travel is strongly discouraged until there is a measurable change in the global situation and normal commercial airlift resumes. Although other airline websites are offering flights to the Cayman Islands, the reality is only Cayman Airways and British Airways have permission to operate flights to and from these islands. Any person who makes reservations directly with other airlines is doing so at their own risk, and should be aware that airline vouchers issued by other airlines are not transferable to British Airways or Cayman Airways repatriation flights. There are no restrictions on outbound travel from the Cayman Islands, and constraints on movement between Grand Cayman and the sister islands were lifted some time ago. Persons wishing to travel outbound on the Cayman Airways repatriation flights to Miami, Kingston, or La Ceiba can book seats directly with Cayman Airways by calling 345-949-2311. Tickets can also be purchased online at www.caymanairways.com. The Explore.gov website is being updated to reflect this new information and also contains a frequently asked question section, which has answers to the most commonly asked questions we have received. Anyone who would like to find out more about travel or the phased border opening should visit the site at www.exploregov.ky/travel. I apologize for the length of that, but it was necessary to get in the information, which I hope will reduce the need for many questions.
Okay. Thank you very much, Premier McLaughlin. Your Excellency.
Yes, thank you. Thank you very much. It's nice to be here again and very nice to see our friends and colleagues from the press in quite some time. I do agree that allowing the option of home isolation for 14 days with additional safeguards, the tracking technology, increased public health surveillance and stronger penalties as well for breaking the rules, instead of having to stay at a government facility. It's a sensible evolution in our COVID risk mitigation. And 14 days remains the WHO best practice duration for anyone who has or may have had contact with someone who has COVID. And I think it's right that that remains the policy for September and October, but clearly there's lots of discussion about what happens after that. And there continues to be a very difficult trade-off between getting some tourism going again and safeguarding the health of everyone on our islands. And many countries are grappling with that. But I've seen at first hand the care and the attention this government and the civil service is devoting to getting that balance right. As ever, the overriding imperative remains the health and welfare of everyone on our islands and managing risk carefully. And our sensible, measured approach is working. The 2 positive cases today, after 4 weeks without any cases, of course it's disappointing, but it underlines the need, as Dr. Lee said, for everybody to stay alert. And actually it's over 9 weeks now since we had any local transmission. So that is really good news, and this is still a terrific place for our islands to be in. But it is inevitable, I believe, that there will be more cases, and we are far from out of the woods in dealing with this very complicated virus. But again, I repeat, I believe we can have real confidence in our excellent health officials, our strong capacity that we've built up as this situation has developed. And having conducted over 36,000 tests is something we can be very proud of, and it gives us confidence. A quick word on BA flights, just a reminder, as the Premier has very clearly set out, BA flights now booked directly, not via the Governor's office. Everyone needs permission from travel time to catch the inbound flight. And as the Premier said, the home isolation policy will be trialled with some of the passengers on the first flight on the 17th of September. And very good news that BA have agreed to run this fortnightly flight for 3 months, so up until the end of November. I just want a quick word on the Deputy Governor's behalf about civil service and the return to work, to the workplace. In consultation with chief officers and heads of department, the Deputy Governor has reinstituted normal working conditions for the civil service. Commencing this week, the default way of working is once again within designated workplaces. Now, of course, we did get some benefits from the COVID crisis from flexible working policies, and that will still be possible. Staff will have to apply in the normal way for the use of remote working and flexible working hours. But where flexible arrangements are permitted, it is conditional upon teams maintaining high customer satisfaction and serving the needs of ministers. But I do want to extend my sincere appreciation to all the hard-working civil servants who toil each day to fulfill our pledge to make lives better on these islands. And I believe the public service has demonstrated very agile service delivery throughout the pandemic. And I'm also pleased to announce on behalf of the Deputy Governor the recent establishment of a Civil Service Programme Board charged with supporting the Deputy Premier and the soft reopening of the borders. And it replicates the successful approach we've taken to combat the pandemic, bringing together senior leaders and technical experts working collaboratively under the chairmanship of the Deputy Governor. So we have leaders, senior leaders from 5 ministries and portfolios. My office is also involved, and the HSA. The Programme Management Office is supplied by the Deputy Governor's Office, but with dozens of technical advisors in a wide range of areas. And we're also working very collaboratively with the private sector, who remain a really important asset for this jurisdiction. Finally, just a very quick word on vaccines. I think it's worth just noting that the WHO remains optimistic that a vaccine will be developed, and the UK remains in the forefront of research and international coordination. You probably saw yesterday that AstraZeneca, one of the key sort of UK sources of vaccines, had to pause a trial because one patient became ill. That's not a surprise, and actually it gives us real confidence in the reliability and integrity and rigor of the trial process for this vaccine, and that trial will not resume until the independent regulator agrees it is safe to do so. I say all this because I've heard, even here on our island, some irresponsible conspiracy theories about vaccines, which I do believe need to be dismissed. The WHO and the international community have established a very strong track record over the years with safe vaccines for Ebola, smallpox, and polio. And as what's happened with AstraZeneca shows, the UK takes this very seriously. The UK has also sourced vaccines from many other places, but it is important because the UK has promised to provide overseas territories with vaccines from its supply, and I think that's a really important point for all of us here. So I will leave it there. Thank you.
Okay, thank you very much, Your Excellency. Minister of Health.
Thank you, Donna. Good afternoon, everyone in the Cayman Islands, big and little, the Caymanian families overseas. Happy Wednesday to all. Scripture readings from Colossians 3:15-17. Let the peace of Christ rule in your heart, since as members of one body you are called to peace, and be thankful. Let the message of Christ dwell among you richly as you teach and admonish one another with all wisdom through psalms, hymns, and song from the Spirit, singing to God with gratitude in your hearts. And whatever you do, whether in word or deed, do it all in the name of the Lord Jesus, giving thanks to God the Father through him. May the Lord add a blessing to the reading of his holy word. Shout out today to all the teachers and students back in school. We wish you all well. And as you've heard today on travel, I would like to add that to have no risks at all, we would have had to maintain a total lockdown for months. But we as a country will have to navigate through these new and strange waters to border reopening. We're learning lessons from the world around us. We are taking all necessary precautions with regards to the reopening of the borders, and will continue to put the public health and safety as our key concern. As we look at the next steps before us, we are keeping a close eye on the epidemiology in the United States and other countries, which helps to inform our decision-making regarding our borders here in the Cayman Islands. Also, I'd like to remind the public that the COVID testing clinic has now moved to the location of the old physio department on the HSA campus, and anyone can book an appointment online, www.hsa.ky/appointment. If people are traveling, they should be sure to book their appointments online within the time frame of the testing requirements for the country they are traveling to. For example, if the country they are traveling to requires a test 72 hours in advance of travel, you cannot get tested a week before departure. The timing is very specific and helps to decide the length of time you may have to quarantine for. For more information on travel advice and regulations, please visit www.exploregov.ky/coronavirus. On another note, plans for this year's 11th Annual Healthcare Conference are moving along well. A comprehensive agenda is being finalized around the theme, Re-envisioning Life with the Pandemic. Topics will include COVID-19 myths, facts and the latest trends, the effects of the pandemic on mental health, how telemedicine has helped throughout the pandemic, dealing with chronic illnesses during the pandemic, cancer diagnosis and treatment during the pandemic, an engaging panel discussion with representatives from various community groups. A reminder that the conference takes place on Saturday, October 17th as a virtual event. The public will be able to watch presentations live on CIG TV and CIG TV YouTube channel and on the Cayman Compass Facebook page. Registration will open next week for those people seeking continued professional development hours who need to participate in the live sessions via video and audio conferencing. Limited sponsorship is still available, and please visit healthcareconference.ky for details and contact information. On another note, I would like to give the public an update from MRCU, as I know many people have been asking. The ongoing rainfall is supporting the production of mosquitoes island-wide, which we have all had to deal with. Aerial larviciding and wide-scale larviciding with truck-mounted equipment took place the 3rd and 4th weeks of August. The biting population levels were low near the end of August, but have rebounded in the last 10 days. Both planes have been flying to combat the situation nearly continuously, and all fog trucks have been actively spraying as well. Planes are expected to fly every night moving forward, weather permitting. Surveillance of swamps is ongoing, and surveillance and treatment of rainwater and container mosquitoes around residences is ongoing. As of today, mosquito breeding has been found in several locations in the West Bay Peninsula, and aerial larviciding operations will commence to control these mosquitoes before they emerge as biting adult mosquitoes. The community is reminded that when possible, any outdoor containers holding water is a potential mosquito breeding site. Tip containers to remove water, toss unused containers in the trash, cover containers when possible, or flush water in containers on a weekly basis. Last but certainly not least, tomorrow is World Suicide Prevention Day. This day is observed annually on the 10th of September to raise awareness of how we can create a world where fewer people die from suicide. Suicide can be a difficult topic to discuss. However, it should not be. I particularly want to recognize the strength and resilience of people who live with suicidal thinking, who have survived suicide attempts, and families and friends and communities who have lost people they love to suicide. In closing, I pray you all continue good respiratory hygiene, social distancing amongst the vulnerable and elderly, and not to forget all the many lessons we have learned through this journey. God bless you.
Thank you, Minister Seymour. We now move to Minister Hugh.
Thank you, Donna, and good afternoon, everyone. I want to thank the Premier for giving me an opportunity just to speak again about some of the efforts being made for the small business sector and some of the other areas, other topics under the ministry. I am very pleased to announce that the Cayman Islands Center for Business Development was officially opened last week. You'd have seen in the press. Again, I'd like to thank Governor Roper, Honorable Premier, the Deputy Governor, Deputy Premier, my cabinet colleagues and members of the business community for participating in that special occasion for us. The center is set up to improve small business viability across our islands through advocacy, business counseling, training, and increased access to finance. It is located at Baytown Plaza on West Bay Road, which is the old HSBC building, with offices for business advisors, a training room, and a residential business incubator, which will hold up to 12 startups for a period of up to 2 years, free of charge to them. As you may be aware, the center has been coordinating government support in the amount of $14 million, which was allocated to the Micro and Small Business Grants Program and to the Low Interest Loan Program, as well as technical assistance, and training programs. At the close of Phase 1 of the Micro and Small Grants Program in August, 1,528 applications were received. The value of grants approved for payment is $3,468,000, and the total value of government's commitment stands at $4,353,000. To date, 82 applications have been received for the low-interest loan program. 19 have so far been approved with a total value of $695,000, and a further 33 applications are currently at the approval stage with a total value of $1,112,000. As we move towards a post-COVID stage, the Center will use the remaining micro and small business grants program funds for a medium-term economic package that will benefit a minimum of 300 businesses. The new phase of support will cover the following areas: wages, digital enablement, commercial rent assistance, business process innovation grants, and a customized business continuity plan. Micro businesses will be able to access packages not exceeding $10,000, while small businesses may access packages up to $20,000. There are eligibility requirements to access these support packages, but I would like to encourage small business owners to contact the center at 244-8009, that is 244-8009, or via email at cicbd@gov.ky, that is cicbd@gov.ky for more information. I'd also like to add that walk-ins are welcome if you're not able to get through on the phones or you do not have the ability to send an email. I'd like to also announce today that we are working on the waiver of liquor licensing renewals for Grand Cayman and Cayman Brac and Little Cayman. This came as a recommendation from the private sector during the Honorable Deputy Premier's public consultation period and the report given during the COVID crisis as one of the key areas that the hotel, restaurant, and bar sector were seeking some support with. So I'm happy to say that Cabinet have approved the waiver of liquor license fees in the Sister Islands for September 2020, and in the waiver of liquor license fees in Grand Cayman for September 2021 for license holders whose fees were paid as of August 31st, 2020. The deadline for payment of the fees in Grand Cayman were last month, and we were not able to get these approvals done before that time, so we will be advancing that credit for 2021 for those individuals, and the deadline for payment for the Sister Islands are at the end of this month, so we're able to give that credit at the end of this month. A full announcement concerning the waivers will be made by my ministry in the coming days. On the matter of liquor licensing and music and dancing, I would like to remind everyone, but in particular license holders, that public gatherings should be limited, whether indoor or outdoor, to a maximum of 250 persons. The police and the Department of Commerce and Investments enforcement arm will be vigilant in enforcing this in the licensed premises in the future. So I'd just like to remind everyone, whether you're indoor or outdoor, that maximum gatherings are 250 persons. On the Department of Vehicle and Driver's License, things have returned to some level of normalcy, including the lines in the facilities, unfortunately. So we'd like to remind persons that the online services, which were taken full advantage of during the shut-in period, is still available, and we would encourage persons to utilize those. We'd also like to announce that we will be emailing out the vehicle renewals where we have the contact information to do so. And so you will be able to renew your vehicles or completely online and receive the renewal via email. I'd like to also announce and say that we are continuing to work to introduce further automation and online services at the DVDL. Those should be coming online in the coming weeks with the goal of having to remove the need for you to attend the Department of Vehicle and Driver's License, or at least attend only perhaps to pick up some documents or for necessary signatures there. I also want to apologize. I know that the congestion in the offices in the West Bay office in particular have been, we've seen some major congestion there, and I would like to apologize. We are working on finding more space, but in the interim, I'd like to encourage those persons to visit our online platform, or perhaps give the department a call to see whether or not you're able to conduct your business online before attending in person to the Department of Vehicle and Driver's License. Another subject I'd like to touch on is, of course, with all schools being back in session, traffic over the last few days have been a bit congested, and we are seeing just how much we are, I guess, back to normal. We were able to get some works done during the lockdown. You'd have seen some of the lanes have been increased. The east-west arterial in the first leg from the Chrissy Tomlinson roundabout have been increased to 3 lanes. We will continue, works are continuing to take those 3 lanes all the way down to, at this stage, the Hurley's roundabout. So works are happening there. The utilities have all been moved, and you will see a lot of work happening on those spaces over the next week or two, taking us 6 lanes in both directions, or 3 lanes in both directions, all the way down to the Hurley's roundabout. We are making tremendous progress on the expansion of the lanes to 3 lanes from the Hurley's roundabout to the King's roundabout. Gazettal notices have gone out for those properties. Works are underway. The utility companies have already begun to start relocating their utilities, and we should see major work happening there in the weeks to come. Also, we will be, during that same period of time, start construction of the Grand Harbor connector. So we'll be connecting the King's roundabout to Grand Harbor. So that we anticipate will help in the evenings, in particular for those moving east in the evenings during the 5 o'clock traffic, by relieving some of the pressure on that roundabout, having the connection into the Grand Harbor development, which we know and can see has grown tremendously over the last couple of years and continues to grow as far as accommodations. For those persons coming out of West Bay, I can also recognize that as soon as you reach around the Commander Bay roundabout and getting into probably what is the most, or the busiest roundabout on Ireland, the Butterfield roundabout by A.L. Thompson's, work has begun. We started work about 2 weeks ago on the first phase of the Airport Connector Road. So that will be connecting the CIS roundabout on the Esther Tibbetts Highway to Sparky Drive. So that is the first phase. Once we've connected that, and then in the future we'll work on taking it from that location, Sparky Drive, through to connect with the Airport Road by the Georgetown Yacht Club. But our traffic modeling system has told us that the breakthrough from the CIS roundabout to Sparky Drive will alleviate a lot of the pressure on the Butterfield roundabout and, by extension, the North Sound Road, which sees a heavy amount of traffic on a daily basis. So that is about all I have to report on for today. Again, we can appreciate the stresses that the traffic situation is causing. I think that personally, I know we've had some readjustments of school hours back to what they were previously. It is our anticipation that over the coming days, as persons adjust to those new hours, that we will see some relief in the traffic, but we are working as diligently as we can, and I must thank the crew at NRA who were working during the shelter-in-place period and getting ahead on some of these roads, but we are moving as quickly as we can to develop the necessary infrastructure to relieve some of the traffic congestion.
Okay, thank you very much, Minister Hugh. As someone who travels from the east, I have to say the hard work is paying off. Traffic is a lot better than it was before.
Thank you.
So we're going to begin by asking questions, having questions from the media. We'll start with April Cummings from Radio Cayman.
Thank you, everyone. Good to see you in person. Mr. Premier, you're on the hot seat today.
One of these are questions.
It's not that hard. I said that, but then I'm about to ask. It's been difficult. We were locked down so hard. It was so painful. Things loosened up. Contractors, construction people started going back to work. It's been hard to get a sense of kind of where we are economically, how government's doing financially. I know you reported on that a little while back. We see things happening and moving, but it's really hard to get a sense of how are we doing? Our borders are still essentially locked down. So what's your take on where we are now and kind of what lies ahead over the next, say, 6 months or so?
Well, I can speak with some confidence about government revenues. I can only sort of measure based on my lifetime of experience here how I think more broadly the economy is going. I don't think we've had those assessments done. But actually, government's revenues are doing better than we had expected. But that's not, that doesn't mean they're doing well. I think we're running, I think, about a $25 million a month deficit at the moment, which is less than we had projected. But we are still, very much in the red with respect to this. We have made significant progress. Indeed, we have come to an agreement with the consortium of banks about the line of credit, but we don't actually have a signed agreement yet, hence the reason why there is no announcement. But we're going to be in very good shape, and maybe as early as next week we'll be able to make an announcement once we've signed on the dotted line. But given the current, if things don't get any worse than they are in terms of government revenue, we shouldn't need that line of credit during the balance of this term. But it'll be a contingency that is in place for, starting the middle of next year, we reckon, assuming things don't get any better generally and we're unable to open the borders and we're still, in pretty much the same situation worldwide as is currently the case. But there is going to be a massive challenge for next year, for the next administration. You look at what's happening all around the world, there is going to be real work ahead. We're doing a lot of thinking and planning ourselves, and that I think, because we did that over the course of these past 7 years, is why we are as able as we currently are to navigate this very difficult set of circumstances. But anyone who believes that things are not going to be very, very difficult in the next coming years, I think don't quite grasp. Sorry, my throat is leaving me. The gravity of the situation that the world is facing and is going to continue to face.
So one of the things that we did to help stimulate the local economy in the short run gave people access to pension funds. We are spending that money. I see it in the hardware store. Things are moving along. But it does raise a concern about whether we're not conserving a little for the future? And I don't mean government necessarily, I just mean us as citizens. Should we be spending? Should we be saving? Should we be somewhere in between? If you were us, what would you tell us to do?
Somewhere in between. The reason why we are doing as well as we are is that money is being spent in the local economy. I hear, as I'm sure everybody has, otherwise, anecdotal reports of lots of money being spent overseas, which I'm not sure is necessarily the right thing to do, but it is people's money. But it is helping the local economy. The staycations are working remarkably well. And people are spending lots of money in the bars and restaurants. It's not enough to make up for the loss of the tourist dollar. But I have a number of friends who are involved in local bars and restaurants, and they've said to me that in terms of the Cayman Islands dollar, because that's how they sort of judge what is a tourist dollar and what is a local dollar spend. August was a better month than they usually see, because August is traditionally August and September very slow months. But we can't go anywhere else on vacation, right? So we stay here and we spend money in the local bars and restaurants. And of course, development is charging right ahead, and those involved in the construction sector are doing really well. I've talked to a number of them. So quite frankly, I think all of us are a bit surprised, more than a bit surprised, that we are doing as a country as well as we are, given the fact that we have no tourists here.
One more thing before I leave you. It can be a bit confusing in some respects, the issue with masks and distancing. Some days we feel like we are completely COVID-free. There's no risk to anyone. We're hugging, we're kissing. On the other hand, there are people who are still have health issues and nervous and unsettled. Dr. Lee touched on it a bit ago, but what are your thoughts on how we should be interacting? Do we still need to be careful?
Yes, we do. Yeah. Very much so. We are not COVID-free. I mean, it's impossible. We just had 2 positives. Yes, they are in isolation, but the risk, as long as this virus is in existence, there is going to be a risk. So we have to manage that risk and protect, in particular, the most vulnerable people in our community. I think it's even more important that we use masks, that we behave safely, and that is, distance ourselves with respect to that demographic, which is why the restrictions remain in place for vulnerable areas like the prisons, the rest homes, and the hospitals, and so forth.
Thank you. That's all my questions for now.
Okay, thank you very much, April. I have a number of questions that I'd like to ask for the public before we go to Wendy from CNS. The first series of questions are for Minister Hugh. You mentioned other programs that may be put in place or will be put in place to assist those who weren't able to tap into the bank loan and the grant assistance. Is there a time frame that those programs may begin to come about?
Thank you, Donna. No, those programs will launch in its entirety on Monday. We don't have a timeline, and of course we have the funding I just spoke about, maybe an issue, but we have a capacity to help up to about 300 businesses, and that's what we're hoping that we will be able to accommodate. The 24 incubators or opportunities for 24 startups to incubate at the business center was part of our original plan, and so that will go forward as usual, and that if those persons stay within the program and develop within the program, they can stay there up to 2 years. So again, we're hoping to be able to assist some 300, and what we're looking for, the businesses we're looking for, those who have now demonstrated, now that the shelter in place is not done, but have demonstrated that they have the ability to transition into the local economy. And now we want to be able to help them continue to grow in that local economy. And I use examples of persons in water sports, perhaps, who were vendors on the beach and just had a walk-up business on the beach. Perhaps now they may want to transition into an online platform promoting that they would deliver a jet ski to you. So if you're staycationing, you can have jet skis delivered to you and they'll pick them up. So those are the sorts of businesses and the direction that we're taking this. So again, some businesses have made it through the worst of it. They're just now struggling to complete that transition into the local market. So we have things like continuity plans, helping persons with developing individual continuity plans, business continuity plans, as well as developing new market strategies.
So those programs are in addition to the grant and the loan. Will they continue?
So let me clarify that. The grants have fallen away.
Okay.
So the grants were there during the shelter in place when businesses could not open. And we wanted to have them survive that shelter in place period, that they would be able to take advantage of business once we were open. Remember that, and I must point out that you heard earlier that the tourism sector will continue their grants. That is separate. The Center for Business Development, we are focusing on the businesses that have the ability to continue to operate, and we want to support them during this period. So the grants have fallen away, and now we've taken it into a post-COVID era where we're offering support now to continue to grow your business or to strengthen your business in the post-COVID area or to solidify your position in a local economy. The loans, the Cayman Islands Development Bank have continued offering loan offerings direct through them. So those who applied previous to the beginning of last month, we will continue to work with them in their loan applications. Those who were unable to meet that cutoff, they can go directly to the Cayman Islands Development Bank. They are now fully staffed. Everyone is back to work. They now have the capabilities and the ability to process the loans directly with the customer. And as we move forward, we will, as a government, we are looking at other opportunities for partnerships with commercial institutions on government-supported loans.
Okay, thank you very much, Minister Hugh. The next question is to Minister of Health. Will the health insurance premium assistance that's been offered to companies be extended to companies in the tourism industry? Consideration being given there.
Yes, thank you for that question, Donna. Actually, we have already been assisting persons in the tourism industry. So they're a part of what we've been doing since April, May, June, and we're still having discussions. We're trying to finalize the new plan, the new rollout. We recognize that we're going to have to continue assisting persons who have found themselves, or companies who can't afford it anymore. And we suspect that because our borders are closed, mainly persons in the tourism sector will be affected most. So we're getting ready to roll out a plan in the next couple of weeks, hopefully sooner than later. We're just finalizing the actual plan, and it's going to take a considerable amount of funds to fund the program all the way through to the end of the year is what we're expecting. So the caucus has given its nod and its approval as to the direction that we want to take this on as a project that we want to manage all the way through. Okay. So we'll make some announcements on the final plans in just a few weeks.
Okay. A few questions for Premier McLaughlin. Thank you, Minister Seymour. Premier McLaughlin, persons are asking who will be doing the random house checks for persons who will be returning.
Public health.
Public health official. Those folks who own properties, let's say on Kim and Brack, will they be able to isolate in their properties in Kim and Brack? How will that work?
I would expect so.
Okay.
because it's the same technology, and we just have to ensure that we have sufficient personnel there to do the checks.
Okay. Pre-COVID, there were direct flights from, let's say, Florida to the BRAC. Is that something that's being considered, or will persons have to travel through Grand Cayman to go to the BRAC from?
As far as I know, only to Grand Cayman.
Okay. Okay, those are the questions for me right now. We'd like to call on Wendy from CNS for her questions. Thank you, Premier McLaughlin.
Thank you, Donna. Good afternoon, everybody. I've got some quick fire ones first for the Premier. Who's paying for the bio buttons and how much is each one?
We're not using the bio buttons for this exercise.
From 1st of October?
No.
Oh, so when will the bio buttons be used?
I don't know. I don't know if they will be used. The technology is constantly evolving, and because we have decided, based on the advice and the science, quite frankly, that reducing the isolation period beyond 14 days carries with it risks which we are not prepared to take. There is no need for a bio button. What we need is the geofencing to ensure that the persons stay in the place of isolation for the required period.
So who's paying for those?
Well, we have to see. We've ordered them. They're on the way. I think the discussion now is around, as you say, who pays for them. Properly, I think it should be persons who are taking advantage of the self-isolation that should pay for them. We're thinking the costs are somewhere between $150 and $200, but that's a lot cheaper than staying in a isolation facility, which is more than 1,000. So even the cheapest of them. But we're still working on those details, which is why I didn't put that into the announcement, because we aren't there yet.
Okay, thank you. That wasn't a quick fire answer though, was it? Well. The other quick fire question, can people stay in hotels from the 1st of October or just homes?
You mean to choose to pay for a hotel room? I would see no reason why not.
Also, the legal changes to the immigration law for the global citizen, is that extensive? Is that underway? Like, what's the plan?
Yeah. It doesn't require much of a tweak to the immigration legislation or regulation. I'm not quite sure where we are there with that, but it's relatively straightforward. We'll certainly be ready for 1st October. Okay.
So the other question is, if we're talking, you're anticipating 800 people a month in October.
For the month of October.
Yeah.
We haven't gone beyond October in our.
No, that's sort of 800 figure. I thought that was quite big actually, because I was just wondering how you arrived at that target, because if you've just got 2 BA flights and there's only 3 flights a week from Cal at the moment, where are these people going to come from?
Well, we expect private charters.
Oh, okay. So in addition to Cal and BA, private jets are still going to be able to.
Right. So if you have a home here, or if you have access to a home that is here, and you have your own private plane or access to one, many people come here. I mean, in pre-COVID times, that's how they come. They come for however long on their private jet.
And just in summary, what aside from the ability to isolate in your home with a geofencing device, what would you describe as being the main differences between what's happening now and what's going to happen on the 1st of October?
Nothing much else, really.
Okay, that's what I thought. I just didn't want to say.
Mm-hmm.
the next question is just a quick follow-up for Minister Hugh with regards to the transitioning of businesses. Do you have any figures yet on how many businesses have kind of been repurposed? So how many people got grants to help them through? And then what if you could maybe be a bit more specific about what businesses have adapted from what to what kind of thing?
Thank you. Thanks for the question. Actually, I need to make a correction. I was being a bit ambitious when I said we had 24 incubators. It's actually 12 incubators that we currently have. As I said earlier, the grants we had 1,528 applications with a value of $3,468,000. And those grants, the application process first included the fact that they had to be in business for a year prior to the shelter in place or the closure of the borders, in fact. And then they had to demonstrate that, in fact, that they had the ability to transition into a local market. They had to provide several months of documentations as far as their operations. There were a number of things that at first would seem a bit daunting, but the center also offered the professional services to help them provide that information. If they didn't have that information, develop that information. So I feel confident that of the 1,528 businesses that were able to take advantage of those grants, that those are all now have been provided with the tools and the opportunity to operate in this post-COVID era. And many are in a better position than they were as far as their support and documentation, their accounting, et cetera, prior to applying for the grants. So this phase now is to continue down that road with in particular with some of those clients who just need that additional hand-holding to move on to the next stages. As well as those who are just starting to rebuild their business post-COVID, where it's not as easy as just opening your door and people walking in and grabbing something off the shelf. So if you were in a sort of a services industry where you're now having to rebuild those services and your clientele, that's what these next phases are designed to do.
So have we seen things like the tour operator drivers becoming delivery drivers and that kind of?
We assisted a lot of taxi drivers were able to take advantage of the program. We did see some persons making that transition into deliveries during the shelter in place. And again, like I said, we're assisting persons like water sports vendors, et cetera, those that now have the ability to support the local staycation trade and have some local clientele in some way.
Okay, thanks, Minister. Oh, actually, this is a broader question. I don't know whether it's probably for the Premier, actually. We haven't heard very much at all. In fact, I don't think the Financial Services Minister has attended any press briefings. So what's that sector telling us about our economy at the moment and where that's going and what signs there are of how the global recession might be impacting us and how that's standing up in general?
All indications are that the financial service industry is doing incredibly well. I've had some reports that for some sectors, August was the best year they've had ever, certainly with respect to funds. So far, so good.
So they haven't said much, there's not been much about how the global recession might impact, because obviously the last time it was very much coming from that sector.
We don't have a global recession. That's one of the amazing things with this, at least not yet. Areas have been impacted, but if you look at the markets, I mean, there's massive optimism all around. One wonders on what it's based, but there you have it.
Oh, yes. And finally, Minister Seymour, what you've just said about the health insurance cover for people who can't make it, is that covering September already? Have they been people that are in the scheme getting cover for September?
Yeah, that would.
And now the plan is to continue it, extending it from there to the end of the year for everybody that applies.
We had a pause in obviously we announced April, May, June 2020, and we had a pause at that time. Anyone who contacted the Health Insurance Commission were told that they wouldn't be covered for July or August. There are still some companies that have submitted invoices, etc. Although no one was ever told that they would be covered for July and August. Now we're considering, we had this discussion in August, so we considered that September would be a month that we would cover, September through the end of the year.
Okay, and finally, with regards to the mosquito control unit, is there any update on what's happening with the investigation within the department about the concerns people had about the methods that the current director had adopted from the start of the season that may have caused some of the problems? Do you know what's happened to that investigation?
I don't really know what has happened to that, otherwise that would be a civil service matter. But what I can say is that some of the methods that we used to use before, I announced earlier, in terms of the what we need to know about the larviciding is that if you see an airplane go up in the air, it means that we have failed.
Right.
So some people think that an airplane is the answer to killing off the mosquitoes. It means that we have failed. We have failed to kill them before they become biting mosquitoes. So some of the methods that we have used in the past in terms of going into the ponds and treating the ponds, some of that had been stopped, but we have now started that back after some discussions with the ministry and MRCU and the deputy governor and a lot of people got involved. I think some of the things that we used to do that were working, that were paused, we have started those back again.
Thank you. That's all I have. Thanks very much.
Just quickly on the BA, just to clear up any issue on that. The contract we signed does provide for 3 flights in October, so there's one on the 1st, the 15th, and the 29th. So they're every 2 weeks.
Uncorrected.
So that might be, I know you want to get your stories accurate always.
Thank you.
I just add that.
Appreciate it. Thank you very much.
Thank you very much, Wendy. And while Kevin Morales is making his way up, I'm going to sneak in 2 quick questions here. Premier McLaughlin, from the public. Premier McLaughlin, there are some rumors that there may be a second pension withdrawal. Are those just rumors, or is that something that's being considered? And as well, will there be an extension on the pension holiday?
Well, I don't know about the rumors. I haven't heard those. I have lots of people asking me for one, but that's not the same as a rumor.
Right.
No, we aren't considering that yet, and we won't for the rest of this year. I mean, that would really be pretty much a last-ditch effort. And the way the economy is moving now, we don't think that we should essentially allow people to take what would amount to or could amount to 50% of their retirement savings. So I'm not saying that it won't happen, but certainly that's not under consideration. But we haven't formalized it yet, but we have agreed amongst ourselves that we will extend the pension, the premium, or not premium, the pension contribution holiday to the end of the year.
Okay. Thank you very much. I think this question may be for Minister Hugh, I'm not quite sure. Some promoters on the island are saying that they're being asked by patrons and people who can't go away and travel if they can hold events. Obviously, the number is at 250 people. However, there was a big event that was held over the weekend where there was a reported more than 250 people. And they want to find out basically if that number will move anytime soon as an increase in number of people that can attend events, and if people are, how people are penalized for having more than the allotted number of persons at a venue.
The maximum numbers aren't set by my department or by the liquor licensing board. That is a public health matter, and the fines are outlined under the public health law. If you breach that, and we certainly don't want to get to that point where we are fining people for these breaches. We're encouraging, under the laws, under the powers that we have under DCI and the Liquor Licensing Board, we're encouraging our members, our licensees to please adhere to these rules. You could end up having your event shut down for the night if you do not adhere to these rules. I don't know
if the Premier doesn't, but what I'd like to say is, I mean, I've had this discussion with the Premier and with caucus, and there's no intention right now to lift the 250, to raise the 250 for a lot of reasons. You know, we're getting prepared now to open and let people in to the country. The last thing we would need is to have a breakout in a situation with large crowds and gatherings, and we need to take our time to get back there in terms. But this will happen, but it probably won't happen until after November. I stand to be corrected, but I can safely say that.
Okay. Thank you, Minister Hugh and Seymour. Just one final quick question. When can we expect to see the phased reopening plan beyond October 1st? Premier McLaughlin?
Probably towards the end of October.
Okay.
Seriously, because we, as I've said throughout this, you know, we are being careful, we're watching, we're being guided by the science and not by public opinion and by experience. So we'll see how well the systems work. The more confidence that we have that people, when they say they're self-isolating, are in fact self-isolating, and we don't have cases of community transmission, the more confidence that gives us to roll the program out more aggressively.
Okay. Thank you, Premier McLaughlin. Kevin Morales?
All right, thank you, Donna. Mr. Premier, you touched on it a bit with Wendy, but can you just say what the motivation was for changing the reopening plan, or tweaking it, I should say?
The experience all around us, really. The U.S. is getting more dangerous rather than less so. We see what's now happened in the UK. So those things have given us, you know, even more pause to say, listen, because we really debated for a long time whether or not we could possibly shorten, even by only 4 or 5 days, the isolation period with the use of the bio button, which would be able to tell the central system, you know, what your vitals are, your respiration, your temperature, etc. And we concluded collectively it's just still too risky.
The electronic device that you're talking about, can you say specifically what it is and where it's coming from?
It's an electronic monitoring device. It'll be probably a bracelet. Okay. Probably be something akin to what they put on you when you go into the hospital. When you're going in, you know, you get this bracelet. It'll be something like that.
Sure.
There'll be a perimeter, a prescribed perimeter, which will be set, and if you go outside of that, it's going to trigger an alarm. If you cut it off, it's going to trigger an alarm. So, and this is something that's proven. This is what they've been using in Hong Kong. So we have a great deal of confidence in it. It's not like we're sort of experimenting with it. And of course, it's entirely voluntary for the human rights folks. If you don't want to use it, you don't. But then you go into the isolation facility at the pleasure of the government.
Are they coming in from the U.S., and are you confident that they can be here by the 1st of October?
Yes, they're on their way. We paid for them. They're ordered. They'll be here.
Let's say they're not. What happens then?
Then we stay where we are.
Okay.
We stay where we are.
All right. Yeah. Cool. Thank you very much for that. Follow-up question on the geofencing. If there's somebody who does trigger the alarm, going where they're not supposed to go or cutting it off, what happens to that person?
I think to be sentenced to life imprisonment or something like that.
2 years.
No, but seriously, they are very very stiff penalties in the public health regulations, and we're going to ensure that we've changed those recently. I think it's a maximum of a 2-year sentence or a $10,000 fine. But I mean, this is really, really serious matter, because if, for instance, those 2 persons who have yesterday tested positive, who were travelers, had been out and about in the community, you just need to think about what the possibilities would be, right? So this is something that the government is going to continue to treat very, very seriously.
And just one last question. In terms of the type of person that's allowed to travel here, can we just reiterate again, it's people looking, it's property owners, residents, obviously, or visitors looking to stay for an extended period of time? Am I missing anybody?
Right. And the new global citizen program that we talked about, with people who want to come to Cayman, to work from here in furtherance of their business elsewhere, that category of persons as well.
Okay, thank you. Yeah. Donna, since I'm here, is Dr. Lee still here that I could?
He's not, but Dr. Sam is
Dr.
here
Sam.
to fill. Okay. Yeah, he can answer
Do you mind?
questions that you may have.
Sorry.
Absolutely, yes.
Thank you. Appreciate it. Dr. Williams-Rodriguez, we've heard from people who maybe have some sort of autoimmune disease or are compromised in that way, who are concerned because now, as we're kind of getting back to normal, they're going back to work in an office setting versus working remotely, where they were able to do their jobs for a significant period of time there. From the people that we've heard with, some of them are feeling uneasy about this because they feel like they're going to be around other employees. Their chance of getting sick is now increased. What would you say to employers who are asking people who have those sort of autoimmune diseases? What would you say to employers who are asking them to come back to work?
Well, my message wouldn't be really for the employer, it would be for this person itself who has the medical conditions. And it's up to them to also to protect themselves. And they know how to do this because I've been doing this even before the COVID outbreak. So wearing masks, social distance, hand hygiene, that's saying the same message. So even if they're in the office and they keep with this measure, they shouldn't be at any higher risk than they were before the COVID-19 outbreak.
All right. Thank you very much. I appreciate it. Thank you.
So, Kevin, I've just been advised that the geofencing stuff, I can't think of the other word, technology arrived yesterday, so it's here.
Great. Yeah. Thank you very much.
Okay. Mr. Ralph Lewis, Caymanian Times.
Good afternoon, gentlemen and ladies. It's a pleasure to be back in studio. I have a few questions. I'll start with the Premier first. Has a global citizen scheme been launched? And if not, when will it be?
It requires, as I say, some tweaking to the immigration legislation. We've announced it, but it hasn't been implemented yet, and I don't know off the top of my head precisely what the start date is. But it is soon. It is part of this overall exercise we're doing to try to bring more people here who have the wherewithal to spend money in the economy. In short, that's what we're trying to do. To help supplement or to fill in some of the gaps caused by the loss of the traditional tourism.
So would it be part of the 800, or will that's in addition to the 800?
We've factored those projected numbers into the 800. Yes.
Okay, thank you. Okay, I have a question for hazard management. I think she was here.
She's gone.
She's gone. Okay. All right, that's fine. I was going to ask if the facilities are going to be able to cope with the increased amount of people coming into the island.
Which hazards are we talking about now?
The hurricane facilities.
Oh, don't dare mention hurricane. But
yeah.
But
okay.
no, we. I mean, we know that we have, and we've been working very hard to try to increase the shelter facilities that to accommodate more people. But we've lost 4,500 people who would otherwise have been here. So, in that context, I don't think we are increasing the risk above what would normally be the case by having another 800 or however many, or a couple thousand more people come here and to stay fairly long term. And we're at the peak of the hurricane season now, so we've got another 2.5 months to run, really.
We hope we don't have one. Moving on to unemployment. Do you have an update on the latest unemployment numbers, or can you say if more Caymanians have been able to find jobs recently?
I don't have those numbers. I gave us address last night at a Rotary event, but the numbers that we used were actually projections through the end of the year, and the projections were that overall unemployment, I didn't have the breakdown, but overall unemployment is expected to be about 6.2% at the end of December, falling to 5.1 over the first half of next year. But of course, those are projections based on a whole lot of, quite frankly, speculation as to how quickly we get a vaccine, how quickly we can return to some semblance of normalcy worldwide.
Are you quite optimistic that our people will be able to find jobs in the next 3 to 6 months in their future?
Well, we're certainly doing everything we can. I talked today at some length about some of the measures that have been employed and are being employed to retrain, retool, create new interest by local people to take jobs that hitherto had been held by expats, principally because Caymanians didn't feel that was a sphere in which they wanted to go. So, and government is going to continue to do whatever we can to help supplement incomes. Thankfully, because of the financial position the government is in, and the level of confidence that there is in the administering of the affairs of government, financial affairs of government, we don't see any real crisis looming financially for the Cayman Islands government for the next year, and therefore government is able to continue to do these things like provide stipends, provide grants, spend money helping people get through this.
Okay, I have one more question for the Minister of Commerce, and I applaud you on the. Sorry. Maybe the next press briefing next week. Ms. Hugh, the Premier spoke about businesses generally doing well, or not doing well, but improving, and the economy seems to be going in the right direction. Can you speak for small businesses? Have you seen an indication that small businesses are starting to see some semblance of recovery, or do you see any movement in that sector?
Yeah, thank you for the question. Yes, we have, and of course they are the ones that are being challenged are those that have made that transition from primarily a tourism-based economy to the local economy. There was a tremendous amount of uptake during the summer, during what we now term as the staycation period over the last couple of months. That has now slowed down as persons have returned to school. But from the retail side of things, and the Premier spoke about the local hospitality offerings of restaurants and bars, we have seen a consistent amount of business there. Not as if things were normal, but certainly in some instances, just after the shelter in place, we had a huge uptick in business. A lot of that was pent-up demand, as well as the availability of the pension funds That has now leveled off, but overall, businesses are managing to maintain.
Okay, and just one more question I just remembered. Some of the facilities, for example, the bars and so on, utilize outdoor areas during the pandemic. Now, the laws have been changed so they can move inside, but some of them still use the parking lots for their outdoor tables. Do you encourage that? Do you support that? Or should they be moving back inside in light of the space requirement and so on?
Yeah, that would be encouraged if persons get the necessary permissions. So you do require planning permission, you do require permission from the Liquor Licensing Board to expand your serving areas in the instances of restaurants and bars. Yeah. Any structures that you put up would require planning permission, even if it is just temporary. So fully encourage it. I think a lot of people are still skeptical about going inside and sitting inside. So if you still have the offering, then that's, it would benefit you. But I would encourage everyone, if you are thinking about it, if you have had temporary permission from planning, you certainly want to avoid any sort of enforcement or any fines being levied on you. So I would encourage you to continue to seek the necessary permissions to serve outside if you have increased your serving space. And if you have put up any structures, even if they are temporary, it's only for a period of time, you need to renew that. So, yeah.
Thank you for your answers, gentlemen.
Thank you, Mr. Lewis. As we wrap up, Wendy has a final question.
Sorry, yes, this came up when you were talking about the geofencing. How will you stop people here going to visit people who are in isolation, because they won't have a tag on and you won't be able to pick them up?
You'll send the police for them, but seriously, that is a problem. But it's a problem we're used to because we've people who tested positive locally, not travelers now who were not in a facility over the course of these past however months we've been doing the testing. They have been essentially allowed to self-isolate at home. We didn't take them out of their homes and put them in a government facility. Only travelers went in a facility. So public health is used to dealing with those issues. And so persons who are self-isolating must expect that they will be checked on frequently and randomly, so they won't necessarily know when persons are coming. So none of these things are without some degree of risk, but I think the risk of being found out that sort of thing is happening is significant as well.
Okay, thank you. Appreciate that.
Thank you, Wendy. I have a final question, and then we're going to wrap up. NAU, has there been an increase in demand? Has that tapered off, or requests from the public?
Yeah, I don't have the numbers here, but the demand has certainly tapered off.
Okay.
Yeah.
All right. All righty. So thank you to everyone who's joined us today from the public. Also, thank you to our panelists, as well as those who've joined us in the room. A reminder to go online to gov.ky for the latest in information and results. Thank you again for joining us.
Air Bridge will depart Cayman for London, and that flight will be full, and it's predominantly for students travelling to start school and university in the UK and